Welcome to Fitness Pro Chat by Fiterobic. Now, on to the show.
Good morning, good afternoon, good evening to all of you. Welcome to another exciting episode of Fitness Pro Chat with Fiterobic. Joining me today is Silvi Shah. Silvi is MD MS. She is an assistant professor in the Division of Nephrology and Hypertension at University of Cincinnati, Ohio. Let's join Silvi today to understand her research interest, which is primarily focused on kidney disease. Welcome to the show, Silvi.
Thanks, Alok. Thank you for having me. I'm Dr. Silvi Shah. I'm a transplant kidney doctor and a kidney doctor at University of Cincinnati. I'm also a physician scientist, and my research lies at the intersection of health equity, pregnancy, women's health, and kidney and cardiovascular disease. So very excited to be in the show. Thank you so much for having me.
I'm actually excited to speak with you. Shirley. Let me start with the first question. What exactly is chronic kidney disease? India is emerging as the diabetic capital as well as the hypertension capital of the world. So we see prevalence of chronic kidney diseases in most of the families. What exactly it is and what causes it and what are the stages of CKD?
Chronic kidney disease, as the name tells us, is a disease of the kidney, which has been there for some time. The way it is defined is by glomerular filtration rate, which is a measure of your kidney function. It's also called GFR. One of the things which is normally done in the blood work, and you would see it as GFR, and it is defined by GFR less than 90. So normally all of us have a GFR or our kidneys are functioning to optimal, it should be 100%. So if there is a decrease in the GFR, that is how chronic kidney disease is defined. Or also the other way to define it is, or diagnosis it, is presence of proteinuria. So the kidneys excrete protein. Now, if there is impairment in the kidney function or there is a damage to the kidney, you may see higher protein excretion in the kidneys. And if that number is more than 0.3 grams, then that's how we would call it, one of the criteria to call it chronic kidney disease. So depending upon
Okay.
the glomerular filtration rate, it can be in 5 stages. We have 5 stages of chronic kidney disease. And usually stage 3 is chronic kidney disease. Stage 3 is when most of the times patients would be referred to kidney doctors when GFR is between 30 to 60. When you're at stage 4, it's between 15 to 30, and when you're at stage 5, it's less than 15. So that's how we define the 5 stages of chronic kidney disease.
So, from a common man perspective, especially given that at least 10% of the Indian population right now suffers from CKD, and every year over 1 lakh cases of renal failure are reported in India. Yet the focus is more on the curative aspect of CKD. And as a nephrologist, what would you suggest to CKD patients? Is it there's a way to slow down the progression of the failure of kidney disease?
That's a great question. And interestingly, in the recent times, in the last couple of years, we have newer therapies which are available and which can now prevent the progression of chronic kidney disease. So this is a very exciting era in nephrology and kidney world, because now we can tell patients you have drugs, we have interventions which can reduce the progression of chronic kidney disease. So again, therefore, the awareness is very important. I think all patients need to know this so they can go to their doctor and they can say, well, we would like to be on these medications. Some of them, the newer medications, are SGL2 inhibitors, which prevents the progression of chronic kidney disease. It also prevents the cardiovascular disease risk, because we all know chronic kidney disease is associated with a higher risk of cardiovascular disease. So I think SGL2 inhibitors is a great medication nowadays, which is available. ACE, angiotensin converting enzyme inhibitors, or aldosterone receptor antagonists, have been available for some time, but that's another class of medication which ends with a RIL, like lisinopril or enalapril or losartan, which are available again to prevent the progression of chronic kidney disease, especially in patients who have diabetes and who have protein excretion. The other third class of newer medication is GLP-1 agonist, and mostly they're approved for patients who have diabetes, and I'm sure a lot of us would have heard they also helps
Yeah.
in weight loss. So,
Absolutely.
however, studies, and there was a flow trial which was just presented this year in a European conference, which actually showed that patients who are taking these medications also have a reduced progression of chronic kidney disease. So they have a kidney protective effect and they have a cardiovascular protective effect as well. So I think it's very exciting. We have these newer interventions, and we are incorporating this now in our practice now currently. So it's all very new, and a lot of because the data just came in recently in the last few years, and the GLP-1 agonist data just came in this year. So I think
Okay. Yeah.
those are some great news for our patients.
No, absolutely. That's quite a progress we are making in the medical field, especially when it comes to CKD. I was just reading one report that estimates that diabetic kidney disease, especially people who are diabetic and then they suffer from kidney disease. It's like 40% of the diabetic patients they're prone to get kidney disease, and that has been like a significant contributor to high risk of all cause cardiovascular mortality in diabetic patients. So, from your research, what are the typical lifestyle factors like have you identified as significant contributors to the development and progression of CKD in diabetic patients?
Yeah, so you're absolutely right. Diabetes is the most common cause of chronic kidney disease. And I always tell my patients that diabetes is a silent killer because you may just see high blood sugar in your blood. You may really not feel anything at that very moment, but it's technically harming your kidneys, it's harming your heart. Those are and stroke, and a lot of my family
Yeah,
members have suffered from diabetes and complications from diabetes as well. So I think the single most lifestyle factor I would say is diet control. I think that's extremely important
yeah,
because Indian diet is very high in carbs, and
absolutely.
it's believed, and even right now I think there's a not a misconception, but it's mostly like it's thought it's oil or it's sugar which causes diabetes, and we should restrict those things in our diet. But I
Absolutely.
think you have to understand that restriction should be in carbohydrates. So,
That's true.
and Indian diet majority is carbohydrates, so rice is carbohydrates. Now, we eat wheat, right? Roti, that's carbohydrates. And
Yes,
especially if you're vegetarian, which majority of us are, or maybe it's majority carbohydrate diet. So
exactly.
it's very challenging to have a carbohydrate control, but you it is needed because if you don't do that, your sugars are going to be high. But again, I think extreme awareness is important too, because as I said, a lot of people are not aware that a lot of foods, even like if in breakfast we will eat poha or we will eat upma, or all that is carbohydrate rich food. So it's important to emphasize we need to have like green leafy vegetables. We need to have like if you're eating egg, like they are high in protein. Then of course if you are able to eat chicken, I think that's healthy. But bread has a lot of carbohydrates, so that should be avoided. Even fruits have a lot of carbohydrates. So there's a misconception, well, we're eating fruits that's healthy, but a lot of fruits have a lot of carbohydrates. Like bananas, they have a lot of carbohydrates. So
That's
you
true.
also have to be very careful in what fruits you're selecting. Ideally, you should consult a nutritionist or a dietitian. That's extremely important, and they will tailor the foods according to your diet. But I think awareness is very important, and following your diet is extremely important too, because if you're not really doing your diet control, your sugars are going to be elevated. So it's not like I'm eating less. I also see a lot of my patients saying, oh, well, I'm eating very less. I'm not eating any sugar. I'm not eating any oil. But unfortunately, even if they eat like two rotis or even if they eat like two bread and, they have rice, that is the total amount. Like it's a very limited carbohydrates you can take in a day.
Yeah.
So that is just consumed in one meal, in one time. I think that awareness and recognition is extremely important and education is extremely important.
I think you have touched a very important point, especially in a country like India, where the awareness level, especially about one's own health, is very low. And that's what, even at Petrovic, that's what we are working towards, creating that kind of mass awareness. And even the purpose of this podcast is to create that kind of awareness so that we can bring the experts like you to help people understand. Yes, it's not about dissociating yourself from eating sugar or maybe replacing sugar with jaggery. I think that's the common fad that most people have. But it's about controlling the carbs, and that's where I think still a lot needs to be done. I'd say we are working in the right direction of putting the right kind of messaging to the audience. That actually brings me to next question, which is like, obviously, I mean, we have seen there a lot of talk about diabetes remission. Everyone talks about you can at least control the diabetes or manage it to an extent. So is there something similar to that could be called as a CKD remission plan or CKD remission program?
So yeah, now there's an increasing recognition of that CKM syndrome, which is basically a combination of like diabetes, metabolic syndrome, chronic kidney disease, because any metabolic risk factors or diabetes increases the risk of chronic kidney disease and cardiovascular disease risk. So it's all of these are interlinked. So what I mentioned was these newer drugs which are available, and actually they were all studied in the diabetic population, and they showed effect for reducing the risk of chronic kidney disease and reducing the risk of cardiovascular disease risk. So I think that awareness, and as I said, these are like these exciting times where we have drugs which can reduce the risk. In the past, except ACE or ARBs, which I talked about, like lisinopril, we had nothing to give our patients. We would just monitor their kidney function, and if they are progressing, they would be either on dialysis or would need a transplant. But now it is believed, I mean, we don't have data, but it's believed that with these newer drugs, we can actually prevent the progression of chronic kidney disease, and we would have lesser patients needing dialysis and lesser patients needing transplant. So, and this, as I said, all these drugs were studied in the diabetic population. So now all the diabetic patients have this new option of having these drugs, GLP-1 agonists, SGLT2 inhibitors, and majority of them should be on it, because as I said, the benefits are enormous.
So are
So in
these
addition,
drugs all? I'm sorry. Are these drugs already commercially available, or is it still in the research?
these are available in US.
Okay.
I know SGLT inhibitors are available in India as well. GLP-1 agonist, I think it is available now. I did hear recent reports, like people are taking it. I think I'm not sure of the cost, how much they cost, but they have been approved, and I know they're available commercially.
That's pretty interesting, actually. So yeah, I mean, and I was reading one of your reports that focused primarily on women's health. So how do you see lifestyle factors, especially in women, affect their kidney health, particularly during pregnancy?
So, a lot of my research is on women's health and pregnancy, and I think one thing is just lack of awareness, and as you were mentioning, not taking control of your own health, because as women are primary caregivers, they take care of families. I mean, that's their traditional role. So, I think just making sure they're aware of it is extremely, extremely important. They need to keep their appointments. They need to make sure they follow with a doctor, then eat healthy. Like we do have these guidelines, not guidelines but recommendations, that they should have enough protein in the diet, they should have enough calories in the diet, they should be on vitamins, they should be on folic acid. So all those things are important and needed in pregnancy. Also, it would depend on what sort of chronic kidney disease you have, or if you're on dialysis, we may have to make some recommendations. So, suppose if your potassium is running high, we have to tell them take a low potassium diet. Depending on their phosphorus, how much phosphorus, if
Yeah.
their phosphorus is running high, we may have to tell them take a low phosphorus diet. So, we may have to tailor these changes according to every patient, depending upon what stage of chronic kidney disease they are in and how their numbers are looking. But I think the important thing to remember is that they need to follow with a doctor. They need to incorporate all these changes in their diet so that the baby is born healthy and their health is they are also overall healthy. So I think that is the impact which these changes make. So that is important for us to remember.
I think that's a very important point that you just discussed about diet control, because that's where I feel most of the patients fail to control their diet, because we most of us have that bad habit of indulgence, and all of us have sweet tooth. We try to consume a lot of sweets as well. So I have a follow-up questions on nutrition and physical activity. So are there some important, say, nutrients and physical activities that especially CKD patients need to take care of?
In general, what we recommend is 30 minutes of physical activity 5 days a week. That is a general recommendation. And I think in general, even if you don't have CKD, we would want to do that. But again,
Yeah,
a lot of us may not be doing it. I think that's where the challenge is. But that is our recommendation, and patients overall do fine. And I think diet, as I think for CKD patients too, this is what we recommend. Now, if they have diabetes, we ask them to do carb control. If they have hypertension, we ask them for salt restriction. If they have high potassium, we ask them like take a low potassium diet, which is basically restrict your food in tomatoes, potatoes, bananas, oranges. They all have high potassium. If you have high phosphorus, restrict your dairy products and eggs and cheese because they have high phosphorus. So we kind of like tell these recommendations to our patients based on the type of chronic kidney disease they have and how their numbers are looking. But as we were talking about, I think the most important thing especially is for our diabetic patients, because the carb control is extremely difficult to do. And I think
yeah,
it's also awareness. We don't know what we are eating, how much carbs it has. So
that's
I
true.
think awareness, we may think, oh well, we are just eating like a box of chips, but that basically you may be done with your carb. If you eat two packets of chips, you're kind of like you have taken your carbs for the day. So I think that awareness is extremely important. Just making healthy choices in your life, like you need to have more proteins. You can have, it's okay to have fat. It's better to have fat than have carb. Like I still see a lot of, actually my some of my relatives still saying that, oh, we made this roti and I've not put ghee in it. But I think ghee is still okay, the roti is not okay. So I think that's there,
That's
it's
true.
just to believe that fats, we should restrict ghee and oil. And but I think it's not recognized that wheat itself gives you a lot of carbs.
Today, I think we are over awareness as well, because there's a lot of videos that are available online, and obviously it becomes very confusing to identify what is right. One, the other person says eat something else. So everyone has their own recommendations. How do we actually segregate between what is right and what is wrong? Because we are all becoming like a 3 second kind of attention span. You go on Instagram, you watch a reel, 3 seconds, and you flip through the reel. So that's the kind of attention span we are getting, and I think that's also affecting our health. Since we are talking about nutrition, mineral and iron imbalance in the body, typically in chronic kidney disease patient, is common. So how can they safely incorporate changes so that it does not affect their health parameters? What are the types of minerals and imbalances that typically happen in the body?
So I think, with regards to your first question, which sources to see, I don't think we should be seeing Instagram reels, because a lot of these reels are done by non-health professionals. So I think
That's
all the recommendations should be coming from a doctor or a nutrition or a certified dietitian, and that is what we should believe. And some papers which have been published in journals about diet recommendations. So I think it's very important to see what the source of these recommendations is, and it should be from the authentic sources. The second question is with regards to minerals. Specifically, a lot of these our patients may be deficient in iron in general. If they have anemia, we do get some iron studies. We want to make sure they are not deficient in folate and vitamin B12. So if they are, we just give them supplements. But we first test it. And if they're deficient,
okay.
that's when we give it. It's not like all these patients are deficient. Some may be, depending upon if they have anemia. So that's what we do. And I think in general the recommendation is just to do multivitamins. We don't specifically supplement nutrients in them. Sometimes we sometimes like do measure phosphorus and magnesium and all these numbers, all these nutrients we measure, but we only supplement them if they are deficient. So magnesium deficiency is also sometimes commonly seen with chronic kidney disease patients. So we would give them some magnesium supplements. Like nuts also have high magnesium in it. But that is the general thing for chronic kidney disease patients. Iron, folic acid, B12 if they are deficient, magnesium if they are deficient. And then we ask them to restrict potassium. If they have high potassium, we ask them to restrict phosphorus if they have high phosphorus.
Okay. I have a very important question. And I think many people would want to know, especially if they have CKD and if they have, say, end stage CKD, at what stage they should actually go for transplant? Because most of the end stage CKD patients are advised to go for transplant. Some go for it, others try to avoid it as well. So, at what stage do you think they should be ready to go for transplant?
So usually the guidelines say like GFR, when your GFR, which you were talking about, is less than 20, they can be listed. They can be
Okay.
evaluated and listed for a kidney transplant. So when the GFR is less than 20, it should be, they are okay to get a transplant. Now, there are a lot of other factors which depend whether they're able to get a living donor, whether, what how soon they're able to get a living donor. But less
Yeah.
than 20 is when they can get a transplant. GFR of less than 20.
That actually brings me to the last question of today's podcast. And what are your recommendations to CKD patients in managing their lifestyle?
I think my recommendation is recognize that you have chronic kidney disease. Just don't ignore it. Make sure you follow with a kidney doctor. Make sure whatever is causing it, and majority of cases it would be diabetes, that you make lifestyle changes based on that. Physical activity is
Yeah.
very important. Diet control is very important, and good control of diabetes is very important, because diabetes is a silent killer, and in addition to it causing chronic kidney disease, it has very bad cardiovascular impact. So a lot of these patients, if they have uncontrolled diabetes and chronic kidney disease, the risk of cardiovascular risk is so high. Like, a lot of these patients will have stroke, will have heart attack, which again is going to impair the quality of life. So I think importantly, recognize your disease and then take control of it. Follow with a doctor. Physical activity, diet control, make sure diabetes is well controlled if that's the cause. And then the newer drugs which I talked about, like, those are things which have shown to be effective in preventing the progression of chronic kidney disease. So I think make sure you are following with a kidney doctor. And importantly, lifestyle, we say physical activity and healthy eating habits. I think those are 2 points I would really like to emphasize.
Thanks, Dr. Silvi, for joining me today for this important discussion. I'm sure a lot of listeners and viewers of this podcast will become aware about CKD. So thanks so much for joining me today.
Thank you for having me. Thank you so much.
Thank you for listening to Fitness Pro Chat by Fiterobic. We hope you had key takeaways from today's episode and learned something new. Don't forget to download and subscribe so you don't miss the next episode, and leave us a rating and review on your favorite platform. In the meantime, reach out to us on Instagram at Fiterobic or through our website, fiterobic.com. And remember, failures will only make you strong and better learned. Take care, stay healthy, and live a fulfilling life with Fiterobic.